I had a user on here reach out to me. Her name is Reagan. Reagan, this one is for you. So Reagan went to have her permanent hard reline on her upper denture. She has natural teeth on the lower, so very similar to this, except for, there are different teeth on her lower that are missing. So when you get a permanent reline, what they're doing is they're taking an impression in this upper denture, and then they are processing that with a new liner on the inside of the denture, hence reline. Okay, it tightens up the denture because she had an immediate denture, 6 or so months ago, and so now she needs that denture to be tightened up because her gums have changed. So she reached out to me before she went to her appointment, and she said, are there any pointers that you want to give me prior to me getting my permanent reline? And I said, the most important thing is that when you bite together, when you put your teeth together, when you're getting that reline impression, you want to make sure to just close. Don't try to put your teeth where you think they need to go. Instinctually close and make sure that that bite is correct, meaning that these teeth on the lower are perfectly matching these teeth on the upper. Super, super, super important, because relines are the one thing that can really foul up a denture, because if the patient doesn't bite correctly into that perfect bite, then it can get messed up, because wherever that, the teeth are positioned, it's going to lock the material into that position. So if the patient, bites too far forward or to the side, then the whole bite is fouled up, and typically it cannot be fixed. Typically you just have to remake the denture all over again. So it's so important. So Reagan went to her appointment, and I don't think that she got my message prior to going to the appointment. I think she got it after she went to her appointment. So the provider put the denture in her mouth to take that impression, and she just put it in her mouth and pushed it up to the roof of her mouth and held it there with her hand. She did not have Reagan bite together. This is completely wrong. And if you're a dental professional, feel free to hop in the comments here and tell me if you think I'm right or wrong. But I've been doing this for decades. My parents did it for decades and decades before I did. I have several family members that also do this. Look in any manual, look in any, Google it. When you do a hard reline, any kind of reline, you need to have that patient coming together and putting their teeth together, because you can't trust your hand and the musculature of your hand, your own physiological movements, to be pushing that denture up into their mouth and lining it up perfectly, because it's not lined up with their bottom teeth. So it is absolutely preposterous that anyone would do a reline like that. Millimeters matter when it comes to dentures. I set these teeth a couple of days ago. Every single one of these teeth have to be perfectly in line with the lower. It's not just, coming together, but it's also the dynamics of chewing and mastication. All of these teeth need to be moving in concert with each other. That's what this contraption called an articulator is for, to make sure that all of these teeth are coming together in a prescribed manner. It's called occlusion. This is protrusive movements where the teeth are touching in the front, and the inside cusps of these teeth, the points of these teeth, are also touching. When you grind back and forth, you need to have surface to surface contact so that you can grind your food. So millimeters matter. So if you are, as a provider, using your hand and your musculature to arbitrarily put a denture into somebody's mouth with, impression material, and you are pushing it up to the roof of their mouth, and you are not having them bite together, then you might be getting away with it, but eventually it's going to blow up in your face. So Reagan, I'm glad that it worked out for you. It seems to me that, they are okay. That was luck of the draw. That should not be done. And, I'm sorry, because Reagan told me, I think she made a post about it, that when she brought this up to them at the next appointment to pick up her dentures, she said, you know, shouldn't I have bitten down? And they were like, what? She said, yeah, when you do a reline, you're supposed to bite down. And they acted like she was stupid. And then she said, you know, I talked to this denturist, and, you know, she told me it was really important to get that bite correct. And they dismissed her. They went in the other room within earshot of her and laughed at her. And that is just highly disrespectful. So if you guys get a reline, advocate for yourself so that it's done right, and so that it's not going to get screwed up. Make sure they're having you bite together. All right, have a great day.